So you need to open your Facebook Live and keep checking.
I don't think so. I'll subscribe to the Apollo page.
You have to just put Apollo Fertility, the page will come. Very good afternoon, everyone. This is Vijay Gita, clinical health psychologist from Apollo CM Fertility, here again with another topic. This time, this time the topic would be on lifestyle and dietary modifications during fertility treatment. Lifestyle, dietary, you've been hearing this a lot. But what is the appropriate diet or an appropriate lifestyle, which is again, person to person differs, though the treatment line is going to be the same. How the treatment expectation or how it is implying varies. Similarly, to a person, one's lifestyle and one's own dietary modification also becomes personalized. So this session is more about properly documented research-based analysis. So I'm going to talk on the basis of a lot of research paper that come up recently for the past 2 years, 2 to 3 years, to speak about how the diet and the lifestyle modification has improvised on the fertility aspects of both male and female. So without a further delay, let's get into the session. Fertility. So let's get a brush up of what actually the term fertility means. It's nothing but one's capability to produce an offspring through reproduction following the onset of a sexual maturity. So the sexual maturity varies from person to person, which is for a female, the onset of puberty, which begins somewhere between 12 to 15 years, and onset for a male would be somewhere between 18 to 20 years. So though the window period varies, the puberty phase is the same. They mature and they are well to move ahead right from 21 years of age, which is what most of the health regime follows. So under female fertility, if you look into very importantly, it is nothing but the ability to conceive a biological child, mainly because female bodies do carry the organ called uterus where the babies are being held. So because of the biological makeup is like this, most of the practical necessary, be it treatment, be it medication, as simple as monitoring, or even the curiosity or the psychological aspect, if you see the need, the necessity, the anxieties, the depressions, the mood swings, all that comes, it all revolves around female due to the biological importance here. So the first important cadre that we see for the infertility angle, where a couple is planning for a family, we see first factor is age. And what else do we see? We would be seeing a lot of other factors which comes to the picture now. So according to the research papers, why age comes to a picture is because there are a lot of things comes up when monitoring of a fertility comes to the picture. First and foremost, when the doctor speaks with the patient, the very first thing that associates with is what she asks is age and the duration of the marriage. So these two important factors caters the basic definition of what makes a couple enter into the platform called an infertility or fertility treatment regime. Two are two different factors. Just because you're entering into an fertility regime, it does not mean that you're infertile. So we remove the myth or the misconception behind that word. Infertility treatment comes for age related factors and other biological correlated factors. There is an infertility treatment regime comes up. So in a fertility treatment, usually the couple is monitored, enhanced, modified. Not only that, with a little bit of support like ultrasonograms, semen analysis from the male side, to see and plan accordingly where a couple is engaged, along with the minimum support from the doctor towards conception. When it comes with infertility, identified biological factors, hormonal factors, physiological factors comes to the picture to say, hey, already there are factors of this that is requiring your treatment management. So when those factors come to the place, it falls into an infertility category. This is where your age, your other hormonal cofactors becomes very important. So fertility treatment or infertility treatment is more or less the same, but the regime is slightly different. What do we look among all this? Initially, we do not see as one who walks in, but it is a couple who is looked in for a consideration. Standardly, there is a timeline that is also coming to the picture gradually, either the man or the woman. The factors that would affect the fertility, the first thing that would come to the picture is doctor would be talking about why don't you plan this in a this way. So the word when the plan or management comes, the first important factor is the timeline. For a fertility couple who's looking for fertility enhancement or just want to plan, the timeline would be either monitoring of a follicular growth or a planned intercourse, or it can be your semen analysis with proper abstinence maintained, to look into certain biological factors to get into the timeline factor to understand where one falls. So this is where timeline plays an important role. In an infertility treatment, let's say there are identified genetic factors or identified uh, chronic ailments like adenomyosis or endometriosis, and the couple is planning to achieve a pregnancy. Here, timeline would be proper treatment in the form of procedures. We would try to first address the current existing women's male condition, or even in male, existing female condition. In case of male, there can be various levels of semen analysis report would say there can be a picture of severe oligo, astheno, terato, or azoospermia. So, based on the availability of what the seminar angiogram speaks, the male would fall into the cadre of whatever is required. So, timeline here plays an important role. When it comes to the female, the factor of female is more about scan and follicular development. In the case of male, we do see that gradually blood test will come to a picture. The doctor would advise about looking into hormone levels and then correlating with the semen parameters which has been taken, associated problems like a thyroid, all that comes to the picture. So these two will be going parallelly. So, be it falling into a fertility line or an infertility line, as a couple, it's a journey where a doctor would help in assisting to move forward. And based on the values or how the body falls into, your duration of getting into the pregnancy is somewhere between a very stipulated time in a span of 3 months or in a span of 6 months. If this timeline drags a little bit. Now, this is where doctor would speak about let's get into serious treatment. So, intrauterine insemination, something called IUI, or if it repeatedly fails, the couple would have been advised for an IVF, in vitro fertilization, or ICSI, which is intracytoplasmic sperm injection. What are the before when a couple listens to these two words, it just takes them back a little bit. People are not sometimes mentally prepared to say, oh my god, is my age is good, we've just married, or we are planning for a family probably after 5 years, or there can be something else coming up, so we are looking for a postponement of our pregnancy, but we would like to achieve the pregnancy as natural as possible, are some of the dream factors that a couple would always obviously carry in their mind. So, psychologically speaking, what are the other factors that would impact for such people? First and foremost, that gets impacted towards any fertility issues is the nutrition. Eating a healthy and varied diet is the key part in maintaining all the good health one requires. However, when we look a little bit into the nuance part, a male body would behave differently, and a female body would behave differently. So if we look into the consideration, owing to the factors of two different bodies. How nutrition can be added? Doctor says eat everything. My husband eats everything and his fitness is maintained. The female eats everything and then there is a weight gain. So, where is what falling would be the first question. Any couple who's looking into the, let's check the other aspects of the life to see to get conceived as naturally as possible. When it comes to a male, the body mechanism or the digestion process is much more greater when compared to a female body. So what happens, the first thing for a male to look into the treatment aspect is, when we look into the seminal angiogram, there's something called reactive oxygenated stress. So ROS is something that looks or affects the semen parameters or the quality of the semen, and that can be helped by minimizing the stress with the help of proper nutrition in the form of antioxidants and multivitamins. Can that same eating parameters can be given for a female? Well, we don't think so. Sometimes for a female, the consumption would should be both proteins and fats, which is beneficial for fertility, because to a minimum extent, good fats are involved in a good egg production. So collectively saying, though everything is the same food plate, how one selects the food matters a lot. And the role of antioxidants in both male as well as in female has shown a significant impact, where the oxidative stress which results in a sperm damage or a sperm dysfunction has been corrected with a right supplement. Also, there are also other multivitamins and nutritions which is also beneficiary aspect, which if you can go through in the previous sessions, I would have spoken about the role of vitamins in fertility. So one such thing that we saw is there is a grave difference between a women's diet and what a male's diet would be. What are the micro things that we would be seeing is what is healthy for a female body towards a good ovulation, and what is good for a male's body in reducing oxidative stress is just what has been seen. Before going on to this hectic talk, let's look if there's any questions. Great. What food to include or avoid to regularize the menstrual cycle before going to start a treatment? There is no direct food to speak about that would impact a menstrual cycle. Your menstrual cycle is impacted with hormones. So see that you have a good consumption of all good fats as well as protein, because research wise, those are the first two indicators that comes to the picture. The second important factor to be seen here is weight. An individual's weight varies and is closely associated with the eating habits and the activity around the person. So, if the BMI is normal, it doesn't mean that the person is not sick, but it just says that the body is well active and within the regime. What if the BMI is high? Nothing wrong though. It's not like we do not we don't see pregnancies among heftier women or heftier men. It's only that it becomes challenging, time consuming, and heavier doses of medications is required for such people. Obesity plays an important role all over when it comes with fertility and fertility treatment aspect. So BMI plays a very important role. Among male, it is closely related to erectile dysfunctions, and among female, BMI is closely related with ovulatory infertilities. There can be problem with the ovulation. So other hormones like serum inhibin B and leptins and all that do also associate along with the hormonal disorders. So this is how we see how weight plays an important role. So any person who is overweight or too obese, along with the age factor, let's say around 35 or more, with an increased BMI, if they face fertility issues, it is better that they start approaching it in a positive angle to see, to avoid miscarriages, to avoid endometrium repetitive in injuries like undergoing and miscarriages, something like that, to rule out all this, your BMI or your obesity or your body weight is how the picturization comes to the picture. So the close association for an extremely bigger numbers in BMI is one among them is in eating disorder. So we started what is associated closely with the body, which is nutrition. And the second important thing, what was closely associated towards the fertility aspect, which is obesity. Third is what we see, what causes obesity, which is eating disorders. So if you realize there's a lot of chain reaction that we are going and catching one over the other, gradually seeing it would reflect from within where one's diet and lifestyle is falling to the cadre. Obesity, not only in a way where weight can impact fertility, people who are underweight are also at a risk of infertility. It can be either male or it can be also female. So underweight can result to lower sperm concentrations, and underweight can also result in poor ovum production. So these are also showing dysfunctions associated with infertility. So maintaining a good BMI matters a lot, where eating disorders have a negative effect among menstruation, among fertility factors, among maternal and also the fetal well-being if the lady is carrying. So to address all the irregularities, a person is actually, according to a few of the researchers, says needs to be diagnosed with eating disorders, and suggesting that women with the history of this and the risk that is imposing on the person's infertility treatment need to be properly educated, or probably given a chart to say what needs to be done to address the factor. Obesity came, eating disorder came. We have tried to identify the hormone imbalances here, how eating disorder or the body weight is affecting the fertility is addressed. What needs to be done? First, lifestyle corrective mechanism is one's own activity. We all are working in current generation. Well, everybody were working for ages together. But what makes the body, despite working, still obese despite not working, is very lean and lanky? We do see people, right? So setting apart the nature of the body, it is because genetics also play a role there. We will look into the first productive aspect, which is exercise. A healthy amount of exercise is very beneficial, like at least minimum 3 times a day. There are research evidences to say it has improved the sperm parameters on all levels. So this is a very promising report from the research which says that a minimum exercise activity weekly thrice for an hour scored higher in almost all sperm parameters. This is very promising one to see whether it is done. Other parameters like the total sperm count, concentration, viscosity had also had a increased with a better results. So what activity fits one, it's left to the discretion to put into practice. We cannot superimpose on that, but this is how a male body's parameters are improvised. Whereas with the female body, the income, the inclusiveness of an exercise activity not only has increased the energy intake, there is a greater balance in hormonal dysfunctions. There are positive implications on hormones, leading to menstrual abnormalities have come down, uh, and increased in not only in the frequency but intensity of the exercise. It has a positive correlation to say that the fertility of the women is much benefited. So very specifically, where a group of infertility women have exercised almost every day, who engage in at least weekly 3 times of cardiovascular exercises, not more than 3 or 4 days a week and an hour or more, has had a positive correlation. However, moderate physical activity has weekly correlated with increased, it is more dependent with BMI. So what activity, how much of the activity, duration of activity, the nature of the activity, and how it is relating with your body, being so subjective. Have a mindfulness in selecting your activity or for your exercise. What would be the psychological effects among such people who are putting into positive lifestyle? Stress, which is the most prominent um, factor in not only the physical but social, but in everywhere. If you see, the first fact that affects the health is a stress. And the entire platform of infertility itself, it can be anything, is pretty stressful. Not only from family pressures, there's societal pressures, there's a lot of testings that needs to be done, there's a lot of diagnosis that comes to the picture, there's a lot of treatments that needs to be selected, and there are a lot of failures in the path. And in the due course, there are a lot of desires that gets unfulfilled, and sometimes there is a lot of physical cost that is involved. Who says no? But how are we going to manage this when we are trying to address every important factor that is being incorporated? There is a lot of improvement that happens in male and female. As I told you right from beginning, both the male as well as the female bodies not only look to a different approach, but also different level of behaviors. Um, Among males, the first impact of stress has come in motility and the morphology of the sperm. So, among male, when the stressful impact they have faced, research says that it first hits in the seminoangiogram. The first two parameters that get uh, lost is one's motility and the morphology of the sperm. So, among male, if there is a stress, then there is a greater relationship associated and leading to infertility. Stress also increases, let's say, post a diagnosis saying that, oh my God, you fall into the cadre of an infertility, and then there is a history of failed IVF treatment. So, among men, how you perceive what needs to be done to overcome that? What are your coping mechanisms? What are your treatment mechanisms? How assertive and how controversial you are, and how are you taking the things in the positive way? You blindly can't say everything will happen positive, right? So with proper information, with the right decision, and probably a good interaction would bring in clarity in most of your decision making. As the research also says that there is a great association between anxiety and stress. So in the course of the treatment, your anxiety actually also kicks in. And the index which was conducted like on psychological parameters also sees that the sperm concentration also get affected. So one affecting leads to other, so there is a chain reaction that comes in. Whereas for a male, this is more of psychological, because he thinks a lot what needs to be done, because physically his body doesn't undergo much, right? In female, it's much more. Why? There is also physical stress that's involved. Repeated visits to the hospital, repeated consultation and scan monitoring, subjecting to various diagnoses, tests and treatments. Because ultimately, wherever the infertility or the fertility lies, it's the female who has to undergo much more. So if it is a working lady or worked up lady, she has to plan accordingly. Psychological stress is pretty convincing to manage among ladies because they are more practical. So the physical stress adds in more. And since they see the result, there is less of mental comprehension. Oh, I did that, but it didn't work. So I'm not going to think beyond that. Among men, if I do that, what will happen? That leads to a chain of thoughts. And those chain of thoughts would lead to four more thoughts. And then that builds in anxiety because none of those thoughts carry a valid answer. Whereas the female stress is, since it's more involving physical and practicality also, but the undergoing factor is pretty much. The psychological stress, as among noted, are anxiety disorders, depressions, and frequent visits and traveling and the physical tiredness, and the entire timeline would go, this is my eating time, this is my resting time, this is my work time. She might not be able to give equal attention or more attention in area that is of concern. So what needs to be done? Couples who actively seek counseling, among very specifically women undergoing fertility treatment, have had a greater conception rate, is one of the research paper that says so. So positive moods correlated with increased chance of pregnancy. As the higher level of anxiety increases the chances of non-conception, counseling sessions or such sessions where the psychologist gives you the proper validation, fertilization um, issues have been much reduced, so the stress associated with that is much decreased. And also there's lot of stress hormone levels that has been released out is been also says, though they are negatively correlated with the fertility of the person, since the stress is being managed and all the stress related hormones are also well handled. Such indicators are very less among counseling seeking couples, specifically women. Let's do some more activities among lifestyle. What is the most important factor of one more thing? One can be social drinking or drinking, and second can be smoking. It can be any cigarette, and why it is very bad. Let's look into this aspect. So, we might not know that one smoke contains over more than 4,000 chemicals, and they are all associated with a lot of potential health complications. If people are not aware of this number was even shocking to me when I went through a few of the information. 4,000 chemicals or more are also associated with cardiovascular diseases and apart from infertility. So among male, how badly it affects is almost 35 percentage of reproductive markers are affected among men who smoke. 35 percentage is too high. The first thing that a smoke hits a person's fertility aspect in the male is the sperm count, its density, motility, morphology, all. The second level we see gradually if the person is not reducing or stopping smoking is the semen volume. And last but not the least, the fertilizing capacity. Even if it is a very good sperm, it might fail to make the egg into an embryo if ICSI is advised. So what happens, why happens, there's a lot of chemical explanation that goes on, but there's a lot of DNA damage or DNA integrity of the sperm being damaged is what is being documented. So couples who are seeking or planning, look into what your habits are also up to. So these are the documented evidence among males. So among females, what happens? Among females, let's say the increase in infertility is noted somewhere between 30 to 35 percentage, and it initially crops in like a hormonal imbalance, looking to menstrual dysfunctions and chemicals associated in oocyte, immature oocyte, ectopic pregnancies are all something that has been documented among women who smoke. And when compared to a female who never smoked or does not have a history of smoking, the chances of pregnancy was more than 52 percentage. So when we look into the environmental factor among females, though the percentage is remaining to be the same, hormonal fluctuations, specifically your follicle stimulating hormones, at the time of the important transition, they are being affected by a smoke. There's alteration in ovarian, uterine tube, which is a fallopian tube, uterine functioning, and also disruptions on other hormonal levels that contribute towards infertility among women is noted. Well, we also see some illicit drugs also coming to the picture: marijuana, ganja, hemp, any other common drug, cocaine. They also have their own impact on the male aspect as well as the female aspect. Though people think, okay, opiates and cocaines and marijuanas is what you mean to see illegal. We are not doing it, but even simple smoking and drinking has the similar impact. Last but not the least, among the medicine part, if somebody has been in prescribed medications for psychiatric issues, they are also involved in infertility related cases. So have a word with your psychiatrist to understand whether the medications that is given to them has an impact in their fertility. Is there an option that can be taken before taking a psychiatric treatment owing to the gravity of the condition to either preserve the fertility or once the medicine is well done and if they are improving down the timeline, whether it is not going to affect the fertility or what is the percentage that is going to affect, a proper understanding on these area is very important. What else we see? We've seen smoking, we've seen drugs, we've seen prescribed medications. Now we will see about alcohol. Alcohol has its own studies from all over the world that says that it is directly related to infertility, both male and female. The percentage numbers remains to be the same, which is 40% and above. But however, women's hangover when compared to a male hangover is much more worst, suggesting that the alcohol consumption doesn't matter, it's the amount of alcohol that affects the person. So have a vigilante to look into what you're eating, what your uh, recreational habits is all about, because among women it directly reduces the follicle stimulating hormone and ovulation in almost most of the cases. So this has been documented. Okay, madam, we are not looking into alcohols. I am not into illicit drugs. I'm not into prescribed medications. But as a commoner, I love my coffee or tea. So, is there an impact of coffee or tea? As research suggests, the impact is really very, very less, at least to just 15 percentage. But one needs to see whether that is the only drink that one is consuming, and still there is a fertility parameter that's being obstructed when compared among days that you have not taken and among days that you have taken. If those parameters lie, well, then you need to look into an alternative. If not, your regular tea, coffee, which is a cup a day, shouldn't bother much. So, caffeine and your regular homely drink as a green tea, you can limit to a cup a day. What about potential health hazards in the form of environment and other occupational exposures? They do affect. So, it is very important to see that your air pollution, your environmental pollution, your occupational exposures equally matters. So, if you are working in such high stressed, exposed areas, it is better to take a break or consult with your doctor to see what protective mechanism, if at all available, to be taken, or whether you need to take a break to see that you will be establishing a family and then you get back to the work, which means that you need to see, you look for an alternative job, because there are greater correlates between pesticides, endocrine disorders, and chemicals among fertility. So there are numerous studies that have come across something like your the BPA, the marker that is found in your plastic bottle, which says that it is free from a chemical, but that also affects. But how much does it takes in? We do not know. So have a mindful before using that. Your pesticides, your phthalates, and solvents do have an impact. But how are they impacting? Gradually, most of these impact comes through impacting the hormones in the person, and then the hormone confusion, disturbances, irregularities leads to internal organs functions disruptions and irregularities. Among your occupation and hobbies, which we saw, most of the people who had looked into being exposed to relaxed, productive lifestyle activities, we've seen the stress, your anxiety, depression, becoming mindful or aware what needs to be done, whether other parameters other than outer than that are being taken care, increased, has seen a positive relation among the infertility treatment seeking couples in a much beneficial way. So what would be your personal care if you see what needs to be done? Hey, there's something needs to be done. Your regular doctor's visit, the most important behavior, to religiously visit your doctor to update, to ask, to counsel, or to look forward for any other subtle parameters. If not, what else needs to be done, reduces a lot of unwanted questions, confusions, mental disturbances. That helps in identifying, diagnosing, treatment, procedure to be much smoother. So current research also talks about, I mean, Your clothing, am I wearing too tight clothing? Will clothing affect fertility? Can hot water shower will take an impact in my fertility? What are the other questions if I see? Let's get back to the questions and see what other factors that would affect the fertility we would look into. Including antioxidants in diet will help in increasing chances of person. Definitely, yes. You need to speak to the doctor which antioxidant that she would be advising for. So there are some common, questions that come up. Will my clothing, though the evidences are rare, but there is no direct correlate. Your stress is what it impacts. If you find it certain doing certain things is stressful, wearing certain things is stressful, well, it will have a stressful impact, but there is no direct impact. So going ahead, we saw a lot about what did we see among females. We saw the hormones, menstrual cycles. We saw BMI and obesity, underweight exposures and overweight problems, low body fat count, and how it affects the ovulation. We saw that among endometriosis or painful periods is one of the conditions, and so forth. Among male infertility, what we saw among them is that the activities of smoking or the recreational activity of drinking, illicit drugs, being overweight, all affect the semen parameters on various ways. Something that hits all the semen parameters at once is smoking. So that's why we see that couple is advised well ahead to stop smoking at least 3 months of gap even before starting off any treatment. Having any present past, any infections, being exposed to toxins or toxic environments, which is what I said. Overheating happens when you are exposed to work conditions which is extremely hot, like people who work towards weldings and welders and all that. So those people need to be concerned about their reproductive health. And experiencing trauma like sports injury among your reproductive area needs to be documented. It can be as simple as falling off from a cycle or getting hurt and forgotten, but if you would inform the doctors or keep informed, which might be a reason to check why certain semen parameters are not coinciding, would be of great help. So some of the research evidences which we saw is that there are a lot of information that we gather. The presence of nutrition, vitamins, antioxidants plays various role. So it works in a particular way for a male, it works a particular way for female. But along with that, good protein and healthy fat diet would also help in ovulating female. So, to maintain the weight, to have a healthy metabolism, exercises was advised, though it gets catered down to what it is. And omega 3 fatty acids among the most beneficial one, as it impacts the sperm morphology. Among women, we see that it has a greater incidences towards conception, and full fat dietary products are associated in lowering the risk of ovulatory infertilities. And also sugar is also somewhere associated with lowering sperm quality, which is specifically for towards diabetic affected people. Also on lifestyle, what did we see? Habits, which is the overall health, well-being, that also affects the fertility. Your age, when do you want to start a family, plays an important role. Your nutrition, which is what you eat every day, weight, exercise, your psychological stress, environmental and occupational exposures, and substantial effects on other aspects also affects one's personal effect on the basis of health, which we speak about is fertility. Something like cigarette smoking, illicit drug, alcohol, caffeine has its own negative influences. So the most important aspect that we see, which bridging between your lifestyle, your diet, your practicality into your more conceptual, your thinking, your psychological stress and behaviors and orientation, we see that age, hormones plays a very close role. So among men, it would be the testosterone that gets affected. Among females, it is the FSH, the follicle stimulating hormone, the luteinizing hormone, and also the estradiol effects. So though broadly categorized, they are hormones, two different bodies, two different hormones, different impact. So this is the common place where we would be looking into how things going to work. And looking forward for other beneficial activities, what are we actually concluding here? What we are trying to see here is the importance of lifestyle factors, your age when you want to start a family, how your entire life is going to be. Forget about just fertility, which is just one aspect. Your nutrition, your weight management, exercise. How do you take care of your psychological stress? Okay, I'm an occasional smoker or drinker, but how are you going to plan it? Your recreation, your hobbies, or your let's say my 1 cup of chai a day. How are you going to handle your relaxational or other habits to your health? Plays a very important role. Behaviors that can be modified. When they are modified, there are greater positive impact seen among fertility and infertility treatments. So try to grab a hint of what needs to be done, so that the most important factor is age and timeline, they don't get lost. Some other informations that we looked into is the vitamins, the nutrition, the antioxidants, your BMI, as well as the importance of reducing stress. So to a female, it can be stress on most of the physical levels. To a male, when it is going to be more of psychological levels, your oxidative stress increases, and then in a female, there is other stress that increases, thereby affecting ovulation here, thereby affecting the quality of the sperm. So among male and female, when we've seen various different way to see what actually works, collaboratively put together, it is just affecting. So try to grab your opportunity to look into whether all these things are managed, because behavior plays an important role. So there is a relationship between a behavior and the endocrinology or the endocrine system. So when we try to alternate the behavior in a very beginning, there are greater chances that we can able to tamper or try to handle the hormonal imbalances. Thereby, not much of things are lost, but something can be recuperated. This is very important. So until then, when we look into all this aspect, you definitely have a lots of questions, a lot of clarity, lots of clouded areas which you do not know how to go. So if those are the things, please look into the number, which is 9686588622. Um, Anapolloseum Fertility. There are a panel of doctors, along with them a psychologist, to help you to walk through your infertility is here. So grab the opportunity, and let's have your fruitful dream coming true. Okay, so with this, I would like to conclude my session, and thank you everyone for listening. See you next time with another interesting topic. Thank you.